Welcome back to NTV News First Edition. It is time now for Get Psyched with Dr. Janine Hubbard, who joins me live in the studio. Dr. Hubbard, last week's topic, ADHD, certainly sparked a lot of interest around the province, so I thought we'd continue our discussion this week. So let's start, or let's talk about adults who have ADHD. Maybe they don't know it. They haven't been diagnosed, they're untreated. So what are the negative outcomes of that?
Sure. Well, we know that our understanding of ADHD has come a long way in the last 20, 30 years, which is why when we're diagnosing kids and teens these days, the first thing we do is talk to the parents and go, who does this sound like? Because we have a whole generation of people as adults who were not diagnosed, and really it's time to be. Because what we know is untreated, undiagnosed ADHD can lead to chronic unemployment or underemployment. It can definitely lead to things like secondary stress and anxiety. Unfortunately, it can lead to increased substance use, alcohol use, sometimes incarceration. There's some fascinating new research that shows that if you have untreated undiagnosed ADHD, you're more likely to contract COVID. So we know, and also it can reduce your lifespan by, in some cases they're saying up to 22 years because of the impulsive actions, so that you're far more likely to be involved in something like a motorcycle accident or a car accident, or something where you injure yourself. So it's really important, if this is something that resonates with you at all, it's time to look at a diagnosis.
Why are women often undiagnosed?
Women far more typically present with the inattentive subtype, which again gets missed, especially if they're well-behaved, smart students. They're labeled as the daydreamers. They're not working up to their potential. Some of the physical activity or hyperactivity is more things like clicking a pen or twirling hair. And women figure out ways to exhibit the signs in a more socially acceptable way. We multitask, we do everything behind the scenes, and we get it all done, but at the end of the day, people are really exhausted. So again, it's one of those that if you were a smart, inattentive, well-behaved girl when you were a child, you probably got missed.
Something else, I know we don't have a whole lot of time left, but something very interesting that you mentioned to me last week off camera is that people with ADHD often do quite well in certain professions, like journalism. So why is that?
Well, and this is just it, because while I mentioned some of the negatives, there are so many strengths and positives if you have ADHD and can find yourself in a profession or a job that pulls to your strengths. So anything where basically we talk about you're chasing the dopamine, anything where you're getting kind of a constant rush, you're working on really quick deadlines, you're working in an excited, fast-paced environment, you're not having to do a whole lot of really tedious paperwork. So journalism, EMTs, emergency room physicians, anything where there's a lot of constant new stimulus that's going to keep you on your toes, those are great professions to go in if you're an individual with ADHD.
I know that if people are interested in finding out more, they can download a whole bunch of forms, I guess self-assessment, maybe forms. Where can they find those?
If you go to the CADRA, C-A-D-D-R-A website, or simply Google CADRA adult questionnaires, you can fill them in, have a significant other fill them in, and then that's a great way to start a conversation. If you have a family physician, if you're already seeing a psychologist, start the conversation, because we are well aware that we've got a lot of people that haven't been picked up. The estimates are 5% of the population. That's a lot of people that we want to make sure that we're treating and identifying properly.
Dr. Hubbard, thank you so much. And my forms are on my desk, by the way.
Well, we'll talk about them after.
Okay.